I am so excited to be able to have these amazing speakers in this next topic. So I'm going to introduce everybody once more. Prior to that, I'm just going to give a quick housekeeping note. So we want to hear from you guys. So I have polling questions that we're going to ask throughout the rest of this session. And right now we're going to be talking about technology as it relates to disease management and as it relates to chronic disease management. And OneDrop is who is our sponsor. We're so thankful for you joining us. It's really just learning about how technology can make this much easier for employers and brokers to manage for their clients. And so we're just so excited to have everybody here, excited to learn what you guys are currently doing, and also, kind of the direction you see the industry going in this. And so, again, for those of you on the line, please populate any of your questions in the Q&A chat module. I'm sorry, in the Q&A module, not in the chat module. If you put it in the Q&A module and we're not able to get to your questions, I'll be able to get all your questions to our speakers afterwards, so I can actually capture them that way. And polling is going to be to the right of your screen there. You can also see all the various polling questions when they come up, and you can vote, so we'll be doing that. And so again, thanks everyone for joining. I'd like to introduce our speakers today. I have Dr. Mark Hyman, VP of Clinical Operations for OneDrop. I have Kate Ciano, Wellbeing and Wellness Consultant for Gallagher. And I have Kalina Markley-Quibell, Director of Wellbeing for Sequoia. I also have Tammy Polanco, Human Resource Director and Business Partner for Neophotonics. And I have Karen Hughes, Workplace Wellbeing Program Associate Manager for Samsung Semiconductor. So I'm going to get started straight away with a polling question. So let me just go ahead and advance my slide here. One moment. All right, audience. So this is your chance to join in. Are you currently using claims data to identify prevalence of chronic conditions and gaps in care for at-risk employees, either yes, no, or not at this time, but we would like to start. So we're going to start the poll right now. We're going to give you about 20 seconds. So again, are you currently using claims data to identify prevalence of chronic conditions and gaps in care for at-risk employees? All right, everybody's starting to vote, so thank you guys for that. Couple more seconds here. Oh, yes. So we've got a lot of you saying yes. About 70% of you are, so that's great. About 20% saying you're not doing that, and we're hopefully going to help you understand how that could help you to manage the at-risk employees. And then, of course, we're going to go straight into to our presentation. So I am going to I don't need to advance that. Sorry about that. So my first question I'm going to throw out there is for Mark. Mark, with all of the new medications and medical devices, why does the chronic disease epidemic continue to grow?
Well, thanks, Jenny. So I really think that the reason for the chronic conditions continue to grow is because we're looking at healthcare in really the wrong way, and we're looking at how we address these issues in the wrong way. Right now, the way we look at it is from a very doctor-centric, instructing a patient about how to manage their condition. And certainly doctors play an important role there. But with many of these chronic conditions, they're self-managed conditions. And so they're not things that the doctor can manage on a day-to-day basis. The doctor can give guidance on them. But the reality is in our current scenario, these chronic conditions are managed on a day-to-day basis by the patient. And so we're really looking at this in a new paradigm of how to look at chronic conditions. And if you advance the slide, really moving from looking at people as patients to looking at them as people, moving away from a doctor, the doctor, to really a coach, where the coach can really help and support the person on a day-to-day basis. And really, that is all supported by technology. Like, we have the ability to do that now using technology. Technology allows us to use data, analytics, and evidence-based behavior science in a scalable way that can really impact chronic disease management. I want to illustrate this by using the example of diabetes. Looking at the diabetes landscape in the United States, the one word that comes to my mind is really scary. The latest stats have about 31 million people in the US having diabetes, with about 29 million of them having type 2 diabetes, which is really a lifestyle-based condition. And of those people, less than 50% of them have an A1C below 7%, or at or below 7%. An A1C is really it's a measure of average blood sugar over the past 3 months. And we know that people who have an A1C of under 7% have a reduced risk of developing diabetes-related complications. And so it's really important that we're able to support people in getting them to an A1C of below 7%. And while medications play a role in that, really the most important factors are, one, making sure people are taking their medications on a daily basis, but also supporting them in behavior change. So healthy eating, stress management, physical activity. We can't do that with the current healthcare system. People see their doctors infrequently, but they're living their lives on a daily basis. So the question is, how do we help people and support them on a daily basis to do this? The answer is really critical to address the human impact and also the financial impact, which is significant, of diabetes. The latest data shows that that the annual cost of diabetes in the U.S. is $327 billion. And so it's with this framework that we look at really a new system and a new way to deliver self-care, not healthcare, to people with diabetes and other chronic conditions in this country. So if you move on to the next slide. So here's a way of thinking about this. The current healthcare system really doesn't serve people with chronic conditions, because the current healthcare system delivers healthcare, and that's medication, that's pharma-driven, that's expensive. There's no integration of care or technology, and really there's no follow-up on a daily or even hourly or even daily or weekly, really or a monthly basis. Currently in the United States, a person with diabetes spends about an hour, if they're lucky, with their healthcare provider every year. And what that means is that there are 8,759 hours that they're spending managing diabetes on their own. And diabetes, like other chronic conditions, doesn't involve just taking a pill on a daily basis and then forgetting about it. Really, it's self-managed. And that means I have to pay attention to what I'm eating. I have to pay attention to how often I'm exercising. I have to pay attention to what my level of stress is. I have to pay attention to a lot of different factors. And the current healthcare system does not support people in addressing those factors on a regular basis. Seeing your doctor for 15 minutes and saying, how's it going? You're doing great, you're not doing so great, isn't really helpful. What people need is they need that constant support, that regular support, and that support that technology can really offer. Next slide. So when thinking about diabetes, the best diabetes care doesn't come from doctors or drugs. The current system is My Doc. It says, My Doc, fix me. That's available 1 hour a year. It's human-based, so it's not scalable. It's expensive. It doesn't really allow for outcomes of care, and doesn't really allow for any kind of regular personalized feedback. There's also the A Doc, Fix Me, which is really the same system, but which includes a layer of technology. So maybe the ability to text your doctor, or the ability to have track metrics like blood glucose or blood pressure, and send that information to the doctor. But with that, really, we encounter the same barriers. We encounter the same barriers that people have with the MyDoc model, with a little bit of extra, another feather in the cap. But what if we have a new model? And that new model is a no-doc system, where we support people in helping them to help themselves, where we're available 24 hours a day, 7 days a week, which is every hour of the year. It's affordable, it's supportive, and it's personalized, and really gives people the experience that they need to really make the behavior changes, to follow the advice that the doctor gives them, but really implement that into their lives and live their lives not as a patient, but as a person with a chronic condition who wants to work, who wants to have their family, who wants to enjoy and be a full part of the community with the chronic condition, as opposed to being a person as opposed to being a patient who has a chronic condition and who has a burden on these systems. And so really, in thinking about why that model doesn't work, certainly medication is important, but really that personalized supportive care on a regular basis, supporting people in making those behavior changes and following the advice of the doctor is going to be a much more effective model in making, in really addressing the issues related to chronic disease.
Thanks, Dr. Mark, and that was great information. I'd like to continue on with our fireside chat. I'd like to start with Karen, if I could. We're going to ask some relevant questions kind of related to what Dr. Mark Hyman just talked about, and just kind of about, what employers are facing, as well as brokers as they manage their clients, and of course the providers that do so as well. So Karen, first question, and then of course I'd welcome all of the rest of the speakers to please interject here after Karen answers if you've got thoughts, as we would love to hear from all of you. So first question, how are you identifying specific chronic disease issues, and then how do you go about helping your employees understand, how to cope with these?
Well, I find that we are using very traditional methods still, looking at some newer things like the color genomics. But right now I'm using the plan utilization information, which is very telling. And also we have an annual biometric screening that we open up to anyone that works on site, not just employees. So anybody can come in and take the screening test on there. We do the finger stick and the fasting, non-fasting test. So if you forget and you eat breakfast, you're not excluded from the opportunity. And when we get the reports back from that, I share them with the people on my wellness team. And the wellness team consists of the dietitian that works in our cafe, as well as our gym manager, who is also a dietitian. And so that allows us to brainstorm ideas on ways we can address the primary issues that come out of our biometric tests, as well as the claims data. And so, for example, we have started a program that is called Mission Nutrition in coordination with our cafe vendor, Guggenheimer. And we're preparing for our third topic. But our first topic was diabetes, second topic was weight management. And so basically it's a 6-week program that is presented by our dietitians, and also is a gym factor that goes with that. So all the participants get a special gym class to help them learn how to incorporate exercise into their routines. And then of course the nutrition counseling, and we keep it into a small group. So we build a little bit of community and familiarity, and each person also receives a private pre-series dietitian counseling and a post-dietitian counseling. So then we're able to measure how the employees have changed over time. And that's been extremely successful. We had 95% of our employees who did the weight management sessions completed the class and also reported changes in their daily habits. So that was a great success. We're working on the next one, which will be metabolic syndrome. We did see some slide back in our biometrics this year on our blood pressure measures. We have some weight issues as well. So we're focusing on biometric syndrome to try to address multiple areas that are included within that. And let's see, I think that one thing you want to remember to do is look at your employee feedback as well from surveys about seminars. I get feedback that's like totally not even what the seminar was about, but it'll reference a certain illness or a disease that can be maybe a future topic. Also, make sure that you're sharing with everyone at your location who can have an impact. So back to my examples, sorry, get that out of the way, of our weight management program. We had nutrition, we had gym activities, we have other things that our facility staff is supporting. We have areas we have a relaxation area, we call it the chill zone, where we have ping pong. And so we promoted a lot of smaller activities on campus to get people out of their chairs and away from their desks, reduce their stress, get them moving. So hopefully I'll be able to get some of those color genomics soon. That would be awesome.
That's awesome. Well, that sounds really great. And I think ping pong sounds like fun. I want to add that to our list of fun things to do. Anybody else on that question that
Yeah,
would like to weigh in
it is.
before we go to the next one? So we've got a number of great ideas that Karen just shared, and thank you so much for that. It's so interesting, for all of us to kind of hear how Samsung and other employers, and as well as brokers, are doing their kind of their best work, really. So thanks, Karen. I'm going to move on to the next question. It's okay. I'll start with Kalina, and I'd like to talk about technology. I know that you have a great deal of knowledge about technology in that space. So I'd just like to start with you and ask you, how is technology enabling new ways of engagement, of engaging participants and providing personalized support and tools?
Yeah, absolutely. Can you hear me okay?
I can hear you great.
Perfect. Yeah, so I'm Kalina, as mentioned, and this topic's really interesting to me because I think there's probably, for those of you joining, different subsets, demographics of employees. So a little bit before I answer the question about my background, I deal with mostly like high-tech companies and based out of San Francisco. So as you can imagine, when you're working with like Netflix or Uber, or Dropbox, the traditional means of supporting diabetes and programs is through the carriers with their different approaches don't always work. So technology is a huge, if not, requirement of all the clients I work with in terms of rolling out a program. I remember once I first got my request for diabetes and went to the carrier to find out how they went about approaching it, and they told me about their, way that they would identify the employee, do one attempt to call, send a mailer, and as you guys can imagine, for a demographic of younger folks that doesn't answer phone calls and prefers text and doesn't check the mail, everything is through their phone, that just doesn't work. And so technology has just become this huge thing in terms of reaching a population that is so reliant on their mobile devices in terms of how they do everything. So what we've done and what we're seeing a lot of employers look for is essentially the Amazon, the Uber of every certain thing that they want to address. So with diabetes, it's no different. They identify something that they want to have employees learn more about, which is how do I take better care of myself and deliver it in a fashion that is much more efficient, quick, supported, log into from anywhere in that way. And I think another thing on this is that a lot of clients don't actually realize maybe that diabetes is prevalent within their population. I think they're starting to see it in claims, but especially for any of you guys that might have a younger population or a seemingly healthy population, I heard from lots of clients prior to looking at the data, this isn't my problem. We're super healthy. Like everyone's really young and active. And this pre-diabetic thing is an issue and needs to get in front of much earlier on. So that's really where we're tailing a lot of our time too, is kind of this pre-diabetic stage, and how do you reach out to people to set them up with the right behaviors so that it doesn't become an issue, which even when I was talking with the One Drop team, I think this is a really important thing to note, is it's not always about, solving the crisis as much as it's doing a lot of this preventative stuff. So when we think about engaging people in these diabetic programs, it's using technology to help reach them with relevant information. So how are you dieting? How are you exercising? What may be to kind of some of the genetic testing, like what runs in your family? What should you be aware of? Those are all really important things. And then it all comes down to just how do you deliver it to employees? So that's where having a mobile app or platform that makes it superly easily accessible, small bites of things people can do. Giving them an hour-long thing they need to do or something like that doesn't always work. It's usually the quicker tidbits of things or a quick chat or things like that that tend to work a lot better. So that's kind of what we're seeing a lot of these innovative vendors deliver to the employers, is a way that they can make something that seems scary and complicated more in line with the trends that we're seeing of, what diet should I be following? Should I cut out gluten from my diet? Like people are kind of self-diagnosing all these things when really they just want someone quick that they can talk to and do so through technology.
Thank you so much for sharing that. And I have to say, you're probably one of the first people to bring up the fact that a lot of populations are younger. I mean, we talked about boomers and we talked about millennials kind of being kind of the major workforce, right? And, even in Hollywood, we see, that major illnesses are, kind of coming after all of us. And, age does not discriminate, illness does not discriminate against age. So I'm really glad to hear you say, it doesn't seem like it might be an issue, because I have, young kids that are entering the workforce or in the workforce. And for me, it's really important that employers like you and others, brokers like you and other employers are, helping people really understand their health. Because what you do, makes the difference for the rest of their lives. And so kudos to what you're doing and the way you're doing it, because technology is definitely key. And also just knowing it is imperative. And so knowing that I could have it. And even though I look healthy on the outside, something could be going on the inside that I need to be aware of. And I just really, thanks to you for sharing that. That's great. So does anybody else have any feedback on technology before we move on to the next question?
So, not sure if you guys can hear me, and sorry, I have an irritant that's blowing over my head. One of the things that I'm finding in my workforce, generally at NEO, we are an older workforce, but we do have some young people here. And when they're diagnosed with a chronic disease such as diabetes, they'll think it's, well, I'm not on insulin, so it's not, the serious type of diabetes. It's just, I can manage it myself. And I think by using technologies, apps, and devices, it puts this information in front of them and lets them know that the condition is not going away and it's something that they have to address. And I think for our younger population, at least, it has helped them become more aware and to seek treatment and to, stay on their medication and understand that this is helping their overall health results.
That's awesome. Thank you so much, Tammy. Anybody else before I move on?
Yeah, I think one thing is the technology also gives people the ability to feel like they can make a difference in that their behavior matters. So certainly it can provide an educational component and let people know what's going on with them. But also it allows them to make those small steps and get immediate feedback about, if I exercise, my weight goes down. If I eat a salad for lunch rather than having a hamburger and French fries and a soda, my blood sugar does not skyrocket high. And giving people that immediate feedback can really be powerful. Also, to Tammy's point about, what people look like, technology also allows an ability for discretion. They're not having to take a phone call or going to the doctor or kind of putting themselves out there as having a condition, but they can manage it kind of on their own time and with their own sense of privacy of, everyone's on their phone. So whether I'm on Instagram or whether I'm on OneDrop, no one knows that. But it allows people to kind of have that empowerment to be able to do that really effectively and discreetly.
Exactly. Right. And I think Kalina said the same thing. We manage our lives by our phones. We look at, our social channels. We are doing, probably most of our employers, at least we do, have an internal webinar, an internal app. And so you're constantly managing everything on these types of devices. So putting it in your hand or putting it on your computer definitely pushes the envelope for engaging. So really great conversation. I think we have another polling question. We do. So audience, we would like your participation one more time. So if you are currently offering chronic condition management programs, how satisfied are you with the results? Are we satisfied with our current program and the results we have achieved? Or two, our current results are okay, but we believe we could do better. 3, overall, we need to do a better job of measuring the results for those who participate in our program. Or 4, we have been able to demonstrate clinical results that have not delivered the cost savings that we were expecting. So a lot of answers there, but we're going to give you 20 seconds. We'll start the poll now. So great. Thanks, everyone, for participating. And those of you that might have just jumped on, the polling is there to your right. You can see, you can participate by clicking on the radio buttons to your right, little button called polls. And everybody is populating their questions now, so thanks, everyone. Let's see what our results are here. It looks like, here we go. So it's a pretty equal, either the current results are okay, but they feel like they could do better, or we need to do a better job. a few of you are satisfied with your current program and results, and so I'm going to call you guys to hear what you guys are doing, because I want to keep telling this story. If you're really happy with what you're doing, then I want these kinds of case studies from our listeners, our members, to be on our virtual summits, because that's the key, is what is really working. And then, of course, some of you are saying, you demonstrate results but no cost saving, and I think that's really important too. They're both important to employers, especially self-funded employers. So let's go on to our next question, and thank you guys for participating in that. So my next question is for Kate from Gallagher. So Kate, what are the biggest barriers to getting employees to enroll and stay engaged in disease management and wellness programs? Oh, you're muted, Kate. Just have to unmute. I still can't hear you. I can't hear you.
Okay. Hello.
Hi.
Can you hear me now?
Yes.
Hi. Okay. Well, I would say, first of all, participation is certainly the greatest barrier that all employers face when it comes to disease management and wellness programs. That's their number one obstacle. Is how do we get our employees to engage and participate? And I'll say first, I think one of the biggest barriers that sometimes we overlook as a first step is really the culture and the environment. If the culture and the environment are not supportive or encouraging the employees to participate, if there's not a strong why message, we care message, then you can have the best disease management program in the world. But if your managers and your leadership are not role modeling these behaviors or communicating the why behind these programs are in place, employees simply won't participate. And I think it also goes down to perceived value, right? And we talked about sort of the younger generations in our workforce, those in their 20s and 30s, who may not think, these programs don't apply to me, so why should I care? So really demonstrating the value and the why. We see now, we used to talk about the millennial workforce not having claims. They're typically non-utilizers of the plan. But what we do know is that they suffer the greatest rates of depression, anxiety, and stress, which oftentimes are at the root cause of things like early development of hypertension and diabetes. So I think if we do a better job as employers and providers, service providers, in making access easy, demonstrating the perceived value, and really having a culture and environment that support access to these programs.
That is so true, and thank you so much for bringing that up. I think it is really telling the staggering kind of statistics on mental health, and so when you do equate those to what you just stated, I think it really does speak volumes to the imperativeness of, one, having a culture of the ability to communicate, as you mentioned, and an environment that's safe to do so. And then really being able to break those kind of misconceptions that you don't have anything wrong because you don't, maybe you don't fall within that BMI sector, but you may have other factors happening that could put you there. So really so true, and that perceived value is so true. So thank you so much, Kate. Anyone else would like to interject here on the biggest barriers, for getting employees to enroll and stay engaged?
Yeah, I was going to add something really quickly. I think Kate brought up some amazing points, is that it's all about, kind of like the culture and how you're promoting it and making sure that it resonates with the population. I think the biggest barrier we saw related to how it was marketed and even kind of the wording of the program itself. To give a example, we had a client who had been wanting to do on-site biometrics for years, and each year it just kind of fell flat, like they couldn't get the right participation. And, they were saying, people were like, oh, I don't want to know my weight, and I don't, all this kind of stuff. And then they started a partnership with Equinox, and Equinox came on site, and all these employees are running around going, have you tried that cool handhold thing? It gives you your BMI right on the spot. And the HR person and I were laughing, just kind of like, so they do want their BMI. It's just they want it through Equinox. Like, so it's all kind of a marketing thing. And I think the biggest difference that we kind of determined was the biometrics came across as disease management, whereas Equinox present themselves on wellness and fitness and diet and just kind of like a more modern approach to how you like do the same thing. So I think a lot of it is really about looking at your audience. And this isn't just young people, in my opinion. It's just that disease management sounds very scary. So I think the more that you can tailor the program toward not know your numbers and, you know, find out things that you didn't want to know about yourself and all of that, and rather kind of look at it more as like wellness and dieting and fitness and all these topics, marketing it that way resonates a lot better with people because it's about making them feel better instead of treating their illness. And I think that's even though it's very similar, it's a big differentiator between the two, is people don't want to be treated as if they're sick, rather they want to be motivated by how to improve their total health. And so I think that is.
Yeah, and I like what Dr. Mark said earlier about self-care instead of healthcare, right?
Exactly.
It's a very different message when you really take that holistic approach that we care about you, and here are a lot of fun and interactive ways to care for your own well-being.
Yeah. It's really about meeting people where they are and really meeting them where their pain point is. And for many people with diabetes or hypertension or you name the chronic condition, that's not top of their mind. But when Kate was talking about stress or depression or anxiety, those are things that really impact people on a day-to-day basis. And so meeting them where they are and getting them into these programs, even if they're going to help them with their chronic condition, you know, based on things that are really important to them to improve, I think is awesome. You know, I'm a psychologist by training, and you may wonder why a psychologist is working at a health tech company. And the reality is that, you know, the barriers that people have to treating their chronic conditions are many of them are psychological or psychosocial. And so helping people to, you know, identify those things and seeing that they're going to get value and they're going to their life is going to be improved, not because the doctor tells them that their numbers are better, but because they feel better, both mentally and physically, is just critical to getting people engaged, but also getting people healthy.
All amazing points. I was just reading an article from Genomind, which is a company that does a pharmacogenomic test that can actually tell you kind of what types of meds actually metabolize properly in your body for the particular, kind of depression or mental like illness that you're facing. And one of the things that I read about was how what you just mentioned, it's just overcoming the stigma. And Kalina, what you also said was turning it from disease management and mental health, you know, care to let's care for our, you know, for our well-being, and changing the way that we, the vernacular really of how we're talking about it, so that it's not a negative. It starts with a positive. So if I'm facing depression, or or I have ADHD, or I have diabetes, I'm not talking about my disease or my mental illness, but I'm talking about my well-being. And so overcoming some of the stigmas, I guess, of those things, and being able to take then the data and the information we have, like say from a pharmacogenomic test or from OneDrop, and be able to just really manage it. I think this is really exciting, and I think the wave of what we're going to see, you know, for employers in the future. So really great conversation. Thank you guys. I'm going to move to the next question. Mark, I'd like to ask you if that's okay. And maybe you can kind of give us some background too on this. Given disease management and wellness programs are not a new topic, what is it about some of these new solutions that are making a meaningful difference as compared to previous approaches? And I think we touched on some of that, but perhaps you could elaborate.
Sure. Can you go to the next slide, please?
Oh, sure.
Yeah. So really, there's a new way forward here, and the new way forward is innovative. But as I said before, the new way forward is not taking the current healthcare system and moving it onto a phone or moving it onto a computer. We know that's not effective, because the healthcare system, the current healthcare system, no matter how it's delivered, is not going to be effective in really managing chronic conditions. Because it doesn't do a great job at supporting self-care. But the new way forward really does. And there's a couple things that integrate into the new way forward. The first is connecting sensors. So being able to measure data on a regular basis, both for really for the individual, so they can see how they're doing on a regular basis and get that immediate feedback. Mobile computing, as Kalina was talking about, having the ability to use this information and use this technology wherever you are to manage your condition, because you're living your life and your condition is coming with you, as opposed to you having to go home or go to the doctor to manage your condition. You want to integrate your condition within the context of your life. And then also using big data. We have a lot of information, and being able to collect data and use it both on individual level and as well as on an aggregate level can help make us all healthier. We can learn from each other, both talking to each other, but also learning from our data integrated with that. To the next slide, please. But it's also important to recognize that this model does not work without a personal touch. People using technology without a person, without an individual, without a relationship there, makes things really difficult. And so in our system, we have a coach. And the coach's role is really to provide that have that personal relationship with our users, and really help them to learn and overcome many of the barriers that they have with their condition and with managing their condition. At OneDrop, the role of the coach is really to provide personal education and feedback and support that's based in behavior science, but to help keep people accountable and to help move them along in their process of managing their condition and living healthier and living the lives that they want to live, to really engaging in that self-care. The goal of the coach is really to help people to overcome many of the psychosocial barriers that are really challenging for people living with chronic conditions, especially diabetes. Barriers like the emotional barriers, feeling overwhelmed and depressed and anxious about their condition, wanting to avoid it completely as opposed to facing it and actually managing it. Cognitive barriers, negative thinking, and what does it mean about me that I have a condition like this, and what does it mean about my future? Social barriers, things like relationships, and how does it impact my relationships at home, my relationships at work, my ability to do my job well. And also coping skills, people feeling overwhelmed with their condition and feeling like they need help coping. And if you notice, all of these things that are certainly they're important in chronic disease management, but they're also important for people's well-being, both at home, but also in their work. They have people who have these skills have the ability to be healthier, both in terms of in terms of their physical health, but also in terms of their emotional health, which can help make them better employees and more productive in that way. And so at OneDrop, we really take the personal coaching process very seriously, combined with, in addition to the mobile computing and the data analytics and the technology, combined there really gives people the ability to self-manage their condition and really provide themselves that self-care that they're not getting in the current healthcare system. But there's another added bonus here is data science. So go on to the next slide. And data science really helps our coaches at OneDrop do a better job at helping people manage their conditions. So we have 1.8 billion data points that have been logged over the past about 3.5 to 4 years. And these data points include blood glucose, they include exercise, they include food, they include medications people have taken. We have about 75 million data points of blood glucose readings over about 1.1 million users. That's a lot of data. And we can do a lot of really interesting things to support people in their own self-care using this data. Next slide. So we think about this in terms of 3 important questions that we can answer with data science. The first question is why? Why does looking at blood glucose specifically, why does my blood glucose go high or go low based on what I do? Giving people the information about giving people that information and having us have that information can be really powerful in helping people with behavior change. The next question that we ask, can you move the slide forward? I think that there may be.
It's got some anime.
Okay, I think go back.
Okay.
Go back one more. Go back one more.
More?
Yeah.
Sorry.
No worries. looking for the 3 important questions about data science slide. Yeah, there we go. Yeah, there's something missing there, but that's not a problem. I can still talk. So the first question we can answer is why? Why is this happening? The second question is how. How do things that I do, my behaviors, how do they impact my blood glucose? How do they impact my blood pressure? How do they impact my weight? Because being able to tie back behavior to outcomes can really be powerful. People like to see, if I do X, if I eat a salad, I will lose weight. If I eat fewer calories, my weight will go down. They're able to get that self-efficacy and that information really powerfully with data. And then for our employer clients, the question is, who is most at risk? Who do we need to focus the most attention on? Who do we need to identify and reach out to and provide support to? With population health management data, we're able to identify those high-cost individuals, reach out to them and provide them with individualized support and care, and empower them in their own self-care, and get them to the right treatment, so that they're able to be more productive employees, so that they're able to be happier and more productive in their own lives, and also so that we can save on healthcare costs to them. It's really a win-win for everybody, and we're able to do that with the power of data. Next slide. We have predictive analytics. And so we're really able, based on data that people log and based on their individual data combined with the aggregate data that we have available, we are able to use predictive analytics to understand not only what's happening for someone right now and what happened to them in the past, but what may happen to them in the future with a high degree of certainty. So a user might log a blood glucose level at 10 a.m. and they may also log a meal at maybe 10:05 a.m. And based on that information, we're able to predict out, using our data analytics platform, what their blood glucose might be, but likely will be 8 to 12 hours ahead of time. And with that information, we're able to give people data that really matters to them, and they can take actionable steps to take to make themselves healthier in the moment. But people have a hard time looking forward and saying, I'm not sure what's going to happen in the future. That's the sense of a lot of anxiety and a lot of uncertainty. And with our data analytics platform, we're able to give people that information about what is likely going to happen based on what we know about them, as well as what we know about the population. Next slide, please. And we know that it works. Our data analytics platform, based on our research, shows that 91% of our data, of our predictions are accurate within 50 milligrams per deciliter, and 25% are accurate within 6 milligrams per deciliter, which is pretty incredible. To be able to say that with a very high certainty that based on what we know about you and the population, that your blood glucose is going to be at X number within 12 hours if nothing changes. And that not only gives a person information about what's going on for them right now, what's going to happen in the future, but it also empowers them with information that they can use that's actionable. They say that because the key thing here is what happens if nothing changes. But the fact is we have 12 hours to change something, and that 12 hours really gives people some information that they can use to really take action and make changes which will make them healthier. Next slide, please. And that brings us to our capability of automated decision support. The question is, what can we do with this data? And the answer is, not only can we predict what someone's going to be doing with their blood sugar and other things 12 hours out, but it also allows us to give them actionable, personalized insights as to what they can do to change things. So for example, if someone sees their blood sugar is going to be high in 12 hours, we might encourage them to eat a lower carb diet that day. We may give them encouragement to take a walk or an exercise. But the data on its own is helpful, but the data combined with a personalized recommendation on how to change something is empowering. And really what our goal here is to do is to empower people in their health and giving them all the tools that they need on a regular basis to do this, and to do this in an actionable way that's going to be extremely valuable and helpful for them in a way that they can see the results. And that's really what our goal at OneDrop is. Next slide.
There it goes. Sorry, going back one.
Back. You went, yeah.
There's a delay.
No worries.
There it is.
Okay. So I started off my question, I think that the first question, talking about what's broken with the healthcare system and really, how it really does not meet the needs of people with diabetes and with chronic conditions. With people seeing their doctor 1 hour a year and having the rest of their time on their own. Really with technology, with our data analytics, with our coaching, with our connected sensors, we are able to make healthcare affordable, accessible, and effective at all times, those other 8,759 hours a year. So that people have the support they need always and everywhere in a really data-driven way. Not taking the current healthcare system and putting it in technology, but really revolutionizing the way that healthcare is delivered and making it self-care. So people can really are empowered to have the insights, the data, and the information, and the support, the personalized support that they need in order to make these changes, on a day-to-day, hour-by-hour basis. And we're able to do this in a way that's affordable and scalable, and in a way that we have shown is effective in helping people to become healthier. And that's really the key here is making sure that we're able to do this on a large scale, in an affordable way, in a way that we know that works. So next slide. So just to give you an overview of the One-Drop Diabetes Management Program for employers. It's a holistic self-care program, which includes the One-Drop mobile app, connected glucose meter, and unlimited testing supplies. We are the first ever ADA-recognized diabetes education and support program that with 24/7 access to a certified diabetes educator. We offer a turnkey program with implementation with a customer success manager, marketing enrollment, and onboarding support, and a monthly performance reporting. So just like we were talking about before, this has to be for employers. We really want to make this as easy and as turnkey as possible. So we take charge of the marketing and really make sure that people are engaged and enrolled, and really see the value of the program. And the pricing is per enrolled participant per month, with a minimum of 3-month program duration to cover the cost of the starter kit and the testing supplies. Next slide. One-Drop also offers a multi-condition management program for employers. We know that diabetes is not the only condition that people experience. And so we offer a program that supports prediabetes, diabetes, hypertension, and high cholesterol. The onboarding process is personalized to meet the needs of each individual employee, and is able to assess them to see what program is going to be the best, or what combination of programs and information for each employee is going to best meet their needs. And we have seamless integration with other connected devices, including a weight scale and a blood pressure cuff. And we also have the ability to support third-party devices, the Apple Health, Google Fit, and Fitbit. Next slide. So what is the new way forward? It's a personalized program that meets the needs of people with chronic medical conditions, not only diabetes, but also hypertension, hyperlipidemia, prediabetes, an all-in-one solution that tracks all kinds of data around healthy living, unlimited supplies and one-on-one coaching, that personalized support people need on a regular basis. We have recognition by the American Diabetes Association, as well as the data science behind what we're doing. We have a lot of data that we're able to use to empower the users, and really both on an individual basis, but also on a population management basis. And we're an accessible, affordable solution that has been proven to work and is backed by over 15 peer-reviewed studies. And so that's the new way forward from One-Drop in terms of how do we address these chronic conditions, not from a healthcare point of view, but from a self-care point of view, empowering people to really take care of themselves in the best way possible.
That's awesome. That really dug deep into kind of the self-care portion of it. I thought some of the telling information was the number of people and the number of data points that you have in the hundreds of thousands. Was in actually, just really, really important.
The billions.
Billions, right? I'm sorry, you're right.
Yes.
Just great data points for all people to really understand, where they are. And really, we are looking for these kinds of ways to manage our health, and to be able to, the predictive analysis, I think, is really great as well. That, at 10 a.m. I might be here, and then I log my meal, and then, it could say predictively by, several hours from now, this is what you're going to be looking like. So let's talk to the coach. Let's hear what you need to change in case you get there. Or maybe you're on track. So yay, good job, you're on track. But just being able to live and breathe in the moment with my health, that's, definitely something I find really interesting, and, kind of fashion forward thinking. And Healthcare Revolution is always bringing these kinds of gems to the table to talk about the solutions that are out on the market to help people really better understand. So you really did a great job. Thank you so much for sharing that. And just to move on to our next polling question before we ask our last question, and just to really engage our audience, those of you that are with us, and I'd love to talk to you about the fact that if a solution exists that utilizes technology to deliver more targeted and personalized programs, how likely would you be to offer it for your employees or for your employer clients? We're going to go ahead and start the poll and give you a couple seconds to answer. I'm just really interested to hear, the sense of the audience's approach as to, what does technology mean to you, and are, is it getting, is it helping you understand how you might better manage your employee population? So I'll give you a few more seconds here. So very cool. I like that we have about 50% of our audience that says they're very likely to add technology to their platforms, and probably already have a solution, but are interested in learning more. And so I'm really glad to see that. So generally speaking, everybody is pretty interested. And those that are a bit skeptical about it, we certainly can answer more questions following this webinar and into our next monthly webinar as well. We'd love to be able to do that. So thanks again for that. And I'd like to just jump into our next question if I could. And I'm going to start with you, Tammy, if that's okay. So Tammy, what have been some of the biggest learnings or surprises as to what does or does not work, given your prior experience with these types of programs?
So I think one of the big things is that really it's only the participants who will decide what is worth their time and what is not, no matter how small you think the investment of time is for them. Whether it's 5 minutes or it's 30 minutes, it's the individual that's going to decide, am I going to do this? And I think the other big thing we're discovering here, at least at NEO, is the reality that, you have groups of employees that are really leading extreme lifestyles. You have one group of people who are fanatic, kind of about keeping up on the apps and exercising. And then you have this other really kind of lazy, indulgent group that, you can't eat what you want, why live, right? That whole attitude. And then in addition, I think the thing that Mark brought up that we haven't really pushed here, but I think will be a big focus for us going forward is the coach, because in addition to people managing these chronic life conditions, people also have other major medical concerns that come up, whether it's someone who's had cancer or heart surgery. So they're trying to manage these conditions along with these other chronic conditions. And I think a health coach could be key, because sometimes they'll get a device or use an app and they're focusing on the wrong thing. So yes, I walked 10,000 steps, but I had cake for breakfast. And I think, the importance of having the balance is key. And the other big, I think, aha that I think all employers will agree on is incentives, no matter how great or innovative you think they are, have a limited time effect. Once the incentive is paid, if the employee is not invested, they stop paying attention to the program.
That's great point. I think I just read an article recently that Kalina wrote about that same thing, just about incentives. So really great points. Anybody else on this topic? I'd love to hear, closing remarks from everyone.
I can chime in. I mean, mine would just be that employees don't always claim they'll use what they are. employees don't always use what they claim they will. So it's kind of like the biggest frustration, I think, for HR people to be like, would you be interested in attending lunch and learn on nutrition? 50 people say yes, 2 people show up. So I think that my biggest advice is just like, it is a trial and error. Like, you really have to figure out what works and then get feedback from why people do or don't do certain things. So, try that on-site education. If it doesn't work, try a different approach. So, we have an example I like to give is, when it comes to this topic, we had a client who tried to do these hour-long lunch and learns on nutrition. Everyone claimed to be interested. No one showed up. So then we tried a different angle where they hired a nutritionist who came on site and scheduled 20-minute appointment slots, and they completely filled up because it was just the difference between committing an hour versus committing 20 minutes. And so that was a learning for that client to be like, okay, my population is interested, they just don't have time. So I think you just kind of have to try and get creative when it comes to what you're doing. And so the biggest advice I always give is, try a few angles. If the topic is of interest, but the format's not working, just kind of keep trying and get some feedback from people until you find the right niche for that.
I think that's great advice. If you try a program that is not successful, don't be afraid to cancel it and try something different. I think as employers, sometimes we have this big rollout, we get invested in it being successful, and when it's not, it's hard for us to say, this isn't working, let's try another angle. So that's key.
Right. Yeah. And I always tell everybody that asks me, my program is a living, breathing thing, and it changes its mind on the spur of a moment. And that's okay. We've got to be flexible. And if it's not working, it's just not working. But back to your nutrition example, we actually created a very short nutrition session. We call it the dietitian's take, and then they choose a topic like fat diets or protein drinks or things like that. So it's a very short topic. We run it right before the lunch service starts.
Okay.
And so people like to get in line first because the lines are very long. So they come to that, which we have downstairs right near the cafe, and then they zip over. So that has had some pretty good attendance. And also what I'm getting good response on is a series that I call the Physician Talks. And fortunately, Cigna has been very useful in identifying physicians to come and speak on site. Sorry. And we do get really good response to that. And there's always, 20 minutes of questions following the end, because people don't want to go to the doctor, but they've got one here on site. And so they get the questions out. And so I think a lot of it is credibility and timing. Absolutely. If it's not working, just let it go.
Wow, great. Kate?
You're muted, Kate.
Uh-oh, you're muted. We can't hear you. Uh-oh.
I don't know where I'm coming through and where I'm not. Can you hear me now?
Yeah.
Yes.
Okay, great. I was going to say, just to sort of recap, everybody's contributions here. I think it's really a successful participation or successful engagement in a program is definitely a combination of leveraging the power of social influence. So that's certainly the environment and culture, relationships between colleagues and managers and HR presence, along with sort of that collective why this is important. I think technology and incentives certainly have a big part in the delivery and initial engagement, but what I've heard every single person say here, whether it's coaching or the wellness team or the lunch and learns, or even just hearing what employees want, it's the human connection that is really driving sustained behavior change, but using tools like technology and perhaps incentives and rewards to drive that engagement. So great discussion today, everybody.
Yeah.
For sure. And maybe we can have Dr. Hyman come back. We can do a short Ask the Expert. You can be the expert, and everybody can ask you, what do we do? Because that's such a good idea, Karen.
I actually have a question for Dr. Heyman. Your one-drop solution, is that available, say, to just an individual who wants to get better control over their diabetes versus just an employer program?
No, we have both a consumer offering and an employer offering. So
Great.
if someone wants to buy it on their own, they're welcome to do that. And if their employer wants to buy it for them, they're more than welcome to do that as well.
Awesome.
I'm glad
Great.
you asked
Thank
that.
you.
We have so many questions that have come through, just so you know, and we will, I promise you guys, get to them. In the interest of time, we do have another topic coming right up, but I would love to give you the last word, if I could, Mark, and have you, kind of wrap us up here. And then, again, we have lots of questions, but we will email answers and we'll get the questions to our speakers after the event. So please.
Yeah, absolutely, Jenny. Well, I really appreciate the opportunity to present here today and really to be involved in this conversation. I think the big takeaways from me are that, the current healthcare system isn't working for people with chronic conditions. Certainly it has its place and it has its role in chronic condition care, but really on a daily basis, that responsibility and that lies on the person. And we need to do everything we can to support the person in their chronic condition on that regular basis, in a way that the healthcare system can't do. And I really believe that solution is a technology-based solution, not taking the current system and moving it on a technology, but really changing the paradigm of how we're addressing these conditions, and really focusing on self-care other than healthcare, using data, using connected sensors and technology with the coaching, with the personal touch, to really empower people to change their behavior and show them that it matters. Not because someone else is telling them they have to or telling them they should, but because they really want to, and helping them to see how that's going to improve their lives, both in terms of how they feel physically, how they feel mentally, and how they're able to interact with other people in the world. And technology is really a powerful tool that people can use in order to do that. So I appreciate the conversation and look forward to answering any questions that come along about OneDrop and about how we approach things anytime.
Thank you guys so much, Dr. Hyman, Kalina, Karen, Tammy, Kate. I can't thank you guys enough for giving us your time and your insight. It is how we drive the industry forward here at Corporate Health and Wellness Association, by bringing thought leaders like yourself together. So from the bottom of my heart, thank you guys for giving us this time. I know each of you is super busy and we went over. So thank you guys so much, and have a good rest of your